Which one do we want? Let's see.
That's it.
You got it?
Yeah.
Brilliant. Okay. So that's who we are. We've just introduced ourselves. Let me skip on to the next one. Oh, here we are. There's the first challenge. Come on. Oh, yes. Okay, so public health nursing, we are health visitors and school nurses. So health visitors work with all families. So from the antenatal period until a child goes to school and turns 5, and they deliver needs based on individual. They deliver a service based on individual needs and assessment. And then the school nurses deliver services to children and young people between 5 and 19, and that's at a population level. So that means that school nurses work with schools to produce profiles to establish local themes and needs and deliver services based on that. The Healthy Child Programme is what we work under. So to explain it a bit, and we do talk about it a bit more in the next few slides, it's we're a universal service. So particularly in health visiting, everybody with a child up to age 5 will have a named health visitor. In schools, they won't have a named school nurse, but they will have a link into school nurses as and when they need it. So let's focus on here. We focus on, so safeguarding is embedded throughout our model. The Healthy Child Programme, that's the HCP, is led by us public health nurses in partnership with other services as and when families need them. It's responsive care, so using techniques to support children, young people and families and help everyone move forward. We're all year round. We're not just a term time service, or we generally work Monday to Friday, 9 to 5, and we use our health expertise to identify health needs, and we have a heavy emphasis on early intervention. Effective signposting is really key. And personalised care, so tailored to the needs of the family and the children and young people. So in the health visiting service, so when 0 to 5, we have 5 mandated contacts. You'll see there's 7 on there. The 2 of them aren't mandated, so 5 of them are, and one of them is the antenatal contact, so that's in the antenatal period. One will be the new birth visit, one at 6 to 8 weeks, one at the 9 to 12 month, and that's a developmental review, and then again at 2 to 2.5 is a developmental review. You can see on there's a 3-month and a 6-month contact. We tend to do those, they're not mandated, but we do tend to do those in clinic settings, in group work. We have assistant practitioners that support the team and who can do additional work around sleep, behaviour, weaning, any other identified need. We can do some additional work at additional points, and like I say, it's based on needs at those contacts. Those 5 contacts are the points of assessment where we see how everyone is doing. Any additional needs that may become obvious, then we can put some care plans in place. We have 6 high impact areas in that early year period, and they're on here. So we support transition to parenthood, so that be antenatal groups and classes and antenatal work. Supporting maternal and family mental health is very key for us, and we do that, obviously regular assessments at points of contact to see how everyone is. Supporting breastfeeding and infant feeding. Supporting healthy weight and healthy nutrition, so that's our weaning and all the bits of work we can do around those. And in some of our areas we've got some virtual weaning sessions, we've got some face-to-face weaning sessions, and they're heavily woven into our postnatal offer in terms of groups and additional points you can access the service. Improving health literacy, so reducing accidents and minor illnesses, and supporting health, wellbeing and development. So at those developmental reviews, and particularly at that 2.5 year one, we've introduced the early language identification model. So that's another part of an assessment where we look at how your child is language is developing and identify any needs at that point where perhaps we could do a bit of intervention for you. The health visitors also support and attend and participate in the MAISEY, which is multi-agency identification and support in the early years. A bit of a mouthful, but you may hear it called MAISEY. So that's where we identify children who might need some extra support and planning for the future for them, and reviewing it each term prior to school level. Information sharing to ensure that we're all aware of the different services that child may require. And identification of linked professional for a school entry plan if needed, and monitoring that child's transition into preschool and then into school. And then discussing whether that child may benefit from that EHCP, so the Educational Health and Care Plan. So for school-aged children, there are 6 high impact areas. So supporting resilience and well-being, improving health behaviours and reducing risk-taking, supporting healthy lifestyles, supporting vulnerable young people and improving health inequalities, supporting complex and additional health and wellbeing needs, and promoting self-care and improving health literacy. And that would take place in the form of clinics, group work, assembly presentations, one-to-one work. And again, that's done on assessment of need. We also do the level 1 primary nocturnal enuresis pathway and constipation. So talking to the school nurse team when I was doing this presentation, they were saying that generally they have a really good success rate with their intervention with their level 1 pathway. And they take referrals from anyone, so GP, self-referral, any other professional. And they primarily work with nocturnal enuresis, but they do look at daytime wetting and urgency, as sometimes these are impacting on that nocturnal enuresis, and they will involve the specialist team if necessary, or at least liaise with them if necessary. So initially forms are sent out to parents and the young person to complete, so that they then get returned, and then that initial assessment takes place to see what's going on for that young person or child. So when the treatment plan is being considered, the team use 3 systems approach, which is part of ERIC, and that is to ensure that treatment's successful and that young person is motivated to be able to make those changes where needed. Usually getting the children to drink more and getting some bladder training is key and really, really helps and has good success. School nurse will liaise with the school, they'll liaise with the GP if meds are required, they'll liaise with professionals who need to be involved, considering constipation all the time. And like I say, we'll liaise with the Continence team if needed, but overall they have really good success rates at that level 1 intervention. School nurses also take part in the National Child Measurement Programme. So every year you may have heard about the National Child Measurement Programme, the NCMP. All children in reception and year 6 have their height and weight measured by the school nurse team. And it's part of a national campaign to help children maintain a healthy weight. And parents in Somerset will be able to request their children's measurements. This is a changeable plan each year at the moment, particularly with COVID. It's been last couple of years have been slightly reduced offer, and we have some plans going forward to help improve this offer for our families. And that's us in a nutshell, but we are open to questions. And if I've said anything that probably was a bit maybe didn't come across easy to understand, we are absolutely happy to take those questions. Liz.
I'm just